Cataract Surgery. Introduction.
Please point to the lens of the eye.
Choose one of the following options.
Correct. The capsule supports the lens. The function of the lens of the eye is to focus light on the retina.
Select true or false.
Correct. Older people are more likely to have clouded eye lenses.
Select true or false.
Correct. Cataracts, which are cloudy areas on the lens of the eye, occur more frequently with age. The most common type of cataract is caused by eye injury.
Select true or false.
Correct. The most common type of cataracts is associated with aging. In the U.S., more than half of the people aged 65 or older have cataracts. A cataract should be removed surgically as soon as it is diagnosed.
Select true or false.
Correct. A cataract needs to be removed only when it starts affecting daily activities, such as reading, watching TV, and driving. In some special cases, a cataract needs to be removed to help treat other eye diseases. An intraocular lens is an artificial lens a doctor uses to replace the eye lens removed during cataract surgery.
Select true or false.
Correct. The risks of infection and anesthesia complications are common with cataract surgery.
Select true or false.
Correct. The risks of infection and anesthesia complications are rare, but they could still happen. After cataract surgery, vision is always improved.
Select true or false.
Correct. Cataract surgery is not always successful in treating vision loss. Some patients may have other underlying eye diseases that may affect the success of the operation.
Thank you for using Explain.